members of the audience. Let me introduce my 3-month progress report. My big PhD topic is clinical pathophysiology of polycystic ovarian syndrome. My name is Rita Vajna. I'm working in the first department of obstetrics and gynecology in Semmelweis University. My mission is to find the best therapy option for higher ovulation rate, endometrial thickness, and pregnancy rate in women with PCOS. My vision is, with the best therapy, more women with PCOS can have a child. There is my specific goals. The title of my first topic is Investigating the Effect of Letrozole on Fertility in Women with PCOS. That will be a systematic review and a meta-analysis. The title of my second topic is Investigating the Efficacy of Herbal Remedies on Metabolism and on Endocrine Status in Women with PCOS. That will be a systematic review and a meta-analysis too. The planned submission date of my first topic in June 2023. First, I would like to speak a little bit about the background. The incidence rate of PCOS from 3 to 10%. The PCOS is the #1 cause of infertility. The most problem with these symptoms, the high testosterone level, the irregular periods, and infertility. We have 2 good pairs options for follicular stimulation. The first one is clomiphene citrate. This is an estrogen antagonist, but this drug has many side effects. For example, vasomotor reaction, headache, nausea, and breast tenderness. The most important side effect is anti-estrogenic effects. This is endometrium thinning. We have an alternative option. This is Letrozole. This drug is an aromatase inhibitor. In the literature was written that letrozole did not show anti-estrogenic effects, and the patient tolerated better, and the pregnancy rate is higher in the letrozole group compared with the patient who use clomiphene citrate. Our aim is to compare the effects of letrozole and clomiphene citrate on ovulation rate, endometrial thickness, and pregnancy rate in PCOS patients. Our clinical question is letrozole effective in treatment of infertility in PCOS patients? The patients are women with PCOS. We would like to compare the letrozole with clomiphene citrate, and the outcomes will be ovulation rate, endometrial thickness, and pregnancy rate. Our hypothesis is letrozole therapy is superior to clomiphene citrate therapy. Our clinical implication is letrozole as an effective therapy to increase ovulation rate, endometrial thickness, and pregnancy rate. I made the systematic search. I found a lot of articles in PubMed, Embase, and Cochrane Library too. My search key was this, which you can see on the slide. This is my flowchart of selection. I found 20 of eligible full text. My topic is feasible. I made the Prospero registration, the duplicate removal, title and abstract selection, and the full text selection too. The title of my second topic is Investigating the Efficacy of Herbal Remedies on Metabolism and on Endocrine Status in Women with PCOS. Planned submission date of my second project in July 2023. The background is similar to my first project. The PCOS affects 1 in every 10 women worldwide. The most significant clinical manifestation of PCOS is hyperandrogenism that affects granulose cell function and follicular development that leads to obesity and insulin resistance. And the end of these problems are infertility and diabetes mellitus. The first-line treatment of these symptoms, metformin, that this drug we have used since 1994. But this drug has many side effects. The most serious is lactate acidosis. that leads to metabolic acidosis, and the end of this problem, the hypotension and hypothermia. We have an alternative option. There are herbal remedies. They have different effects. For example, increasing estrogen level, anti-androgenic activity, and pregnancy rate. These drugs, these herbal remedies can reduce the oligomenorrhea, the BMI, insulin level, LG level, and the like. Our aim is to compare the effects of herbal remedies and with short-term metformin or placebo regarding metabolic and endocrine status in PCOS patients. Our clinical question is, can herbal remedies improve the metabolic and endocrine status in PCOS patients? The patients are women with PCOS. We would like to compare the herbal remedies with short-term metformin or placebo, and our outcomes will be different metabolic and endocrine parameters, which you can see on the slide. Our hypothesis is herbal remedies have a comparable effect as short-term metformin and are superior to placebo in the treatment of PCOS patients. Our clinical implication is herbal remedies as an effective therapy to improve the metabolic and endocrine status in PCOS patients. I made the preliminary search. I have found a lot of articles. My search key was this, which you can see on the slide, and the summary. The planned submission date of my first project in June 2023, and of my second topic in July 2023. Thank you for your attention. And my sentence is, what you can't explain simply, you don't quite understand, said by Albert Einstein.
Congratulations on your outstanding presentation. I'd like to ask you about your second topic. Is long-term usage of metformin an exclusion criteria?
Thank you for the question. Yes, in the literature was examined the herbal remedies through only 3 months. Therefore, I will compare this effect with the short-term metformin. The patient used that only through 3 months.
Congratulations. I really like both of your projects. I have some remarks for the second one. How did you establish the search key? Because there I saw a list of some natural compounds and some plants, but do you think it's extensive enough for this meta-analysis and systematic review? Because I'm not really sure. Mm-hmm. So how did you establish the search key? Mm-hmm.
With this search key, I found a lot of articles, and this research will be perhaps network meta-analysis. At the moment, I found only 11 good herbal remedies which have a good which have a good effect for the metabolism and the endocrine status.
But why did you choose exactly these plants and compounds for?
Because
for the
in the literature was written about these herbal remedies, the articles. This is the relevant herbal remedies. Mm.
I have the impression that some plants are missing and there are some items that are not really necessary. Mm-hmm. So if you think, I can discuss it with you later. Because, for example, octane, I don't know why it's there, for example, and some important plants are missing from the list. So I would suggest to reconsider to improve a bit this search key.
Okay, thank you very much.
I'm going to have just a question. Do you intend to do a subgroup analysis for those related effects in your second project? I mean, there are no standard doses for these herbal remedies. Will you make a search on how much milligrams, for example, to be given, for example, a cinnamon oil or so to be effective?
Okay, thank you for the question. Only the cinnamon, for example, the patient use 1 or 2 tablets per day. This tablet contains 200 milligrams for this. 200 milligrams cinnamon. Thank you very much.
Thank you for your presentation. I would like to ask you the short-term metformin treatment you mentioned. There was a study published in 2007 by Legro comparing the effect of clomiphene citrate and metformin in ERT cycles. And it became a highly criticized study because they started to use clomiphene and metformin together, and they observed that the clomiphene is much effective. But you have to know that when you start to use metformin, you have to wait until 2 to 3 months to stabilize the effect. So that's why I ask you how to plan your study, because if you do not have a study, a stable effect of metformin, probably you won't have good results. And the other question is, what will be the dose or a dosing protocol of metformin?
Thank you very much. In the literature was written that the patient with herbal remedies was examined only through 3 months. Therefore, I would like to compare with the short-term metformin. The patient used similar to the herbal remedies, and when the patient used herbal remedies, in the literature was compared with the placebo too, and we hope that when the patient used the herbal remedies only or with short-term metformin, we will come a better metabolic status and endocrine status when the patient use nothing or only short-term metformin.